you all for joining us today. We are here at Witham Health Services in Lebanon, speaking about how things have gone since March, since we spoke, about how COVID has changed how we do things and what we can do now. So let's start over here.
My name is Gene Davis. I am the Director of Infection Control at Witham Health Services.
And to my left?
I'm Dr. J.R. Serbies. I work here at Witham. I've done a lot of things over the years, but I've been your county health officer for 23 years.
And my name's Claire Houghton. I'm the health educator for the Boone County Health Department and also the public information officer.
I'm Crystal Jones. I'm an infectious disease physician here at Witham Hospital, and I also serve on the Boone County Board of Health.
So, how has COVID changed how we conduct ourselves? Things have changed a little, so things have changed a lot. So, what can we do now to keep ourselves safe as we know more about COVID? And what now do we know that we can share with others and we can do ourselves?
Well, one of my duties at the health department as a health educator is to research as many different health topics that are relevant to what's going on. I do remember, I was sitting at my computer back, it's either end of December or January, I remember reading a headline. It said, mysterious pneumonia-like illness pops up in Wuhan province in China. So we've been tracking it since then, since before it even had a name. And we have definitely come a very, very long way. We've learned so much more about the virus than what we did before. And it can be a little bit exhausting because the information is changing so often. And so I think we get a little bit of message fatigue when all this new information is just constantly pounding us. But at the health department, we try to stay on top of it as much as we can and disseminate that information to the public. And while it is frustrating with all the new information that's coming out, I'm thankful for it because that just means that's all the more that we know about the virus. That's all the more we know about the disease. And then that just means we know better how to treat it. We don't have a cure for it yet. We don't have a vaccine for it yet or anything like that, but we're working on it. And again, the new information can be hard to stay on top of, but it just means that we know a lot more than what we used to. So try not to get too fatigued and try not to get too annoyed with all the information coming out. It's still very, very important information, and the more we learn, the faster we're going to be able to put a stop to this.
I think from my standpoint, as I said, I've been a health officer for a number of years, and for years and years, I would go to the health department maybe once a week and sign some papers and stamp out a flyer. But now I'm there almost every day, several hours a day. It's a lot more than just signing papers now.
From my standpoint, I'm kind of like Claire. First thing I come in every morning and open up my computer and log in and then begin looking through various listservs that I've signed up for to get new information about the virus itself, treatment modalities, contact investigation, infection control principles, because those are constantly changing. And probably the first 2 hours to 3 hours of my day is spent dealing with COVID. I serve on the incident command team here at Witham, and so we have daily meetings. For a little bit, we were able to go to 3 times a week meetings, but now it's back to daily meetings because it is just changing constantly. As new things are discovered, new recommendations come out from the state Department of Health or the CDC, with our goal to continue to serve our patients here at Witham and provide the best health care that we can, and also keep both our patients and our staff safe and healthy.
So if people are looking for the most recent information through Witham, through the health department, where can they find that?
I think there's two things that Crystal and I look at all the time, and I think there's a lot of good information on the ISDH website. They've got all the latest statistics about new cases and deaths and hospitalizations, etc. But They also have a lot of, I think, easy reading articles about going back to school or going to work or when can I go back to school or when can I go to work. The other one is the CDC. Again, same thing. Great website, a lot of information. It's not. Both these websites are not designed just for physicians. I mean, they're designed for everybody to read and understand.
And that's one question that I'll get. I help to run the health department Facebook page, and I try to respond to as many comments as I can. People appreciate the transparency. We're try not to keep anything from anybody, but we also do need to try to respect people's privacy and their experiences with COVID. But that's a question I get every now and then is, okay, if you're going to provide this information, is this something that I can share with my friend, or is this something that only you have access to at the health department? And oftentimes, no, this is the information that I'm giving it's going to be available to the public. It will be available on the Indiana State Department of Health website or the CDC or even the FDA sometimes. And so it's our job at the health department and also with Witham and all the other parties involved in our COVID response to try to stay on top of the information as much as possible. It is very confusing. It's hard to know what's up to date and what's considered old information. But if people ever have questions, all they have to do is maybe reach out on Facebook or give us a call, give us an email, and we do spend a decent chunk of our days answering phone calls and answering emails just for people just curious about what they need to do or curious about what's going on, and we're happy to help.
With flu season coming up, we're going to have another wave of what's going to look like illness. So how do people determine if they have the flu or if something is COVID? What can they do in order to get the proper testing in order to make sure that that's something that they know how to treat it properly?
I think it's going to be very difficult, in all honesty. And I think we're going to see some individuals that have both the flu and COVID, which is going to make it even more difficult. If my recommendation, if someone is symptomatic and they, and when I say symptomatic, the symptoms are very, very similar, if not exactly the same. If they have a primary care provider, they need to be on the phone talking to their primary care provider, who then can direct them to the appropriate procedures that they need to do. One of the things that we as Witham physicians are preparing to do is to try to determine if an individual has COVID, flu, or both, or maybe any number of respiratory viruses. So there are some testing panels, and so I suspect that the primary care providers will be ordering a lot of tests. Right now, Witham is doing some drive-through testing for COVID with a physician order. So if you are having symptoms, please talk to your primary care provider. If they think you need to be tested, they can send an order to Witham and to our testing sites, and then we can get that test done and get it back as quickly as possible. If you don't have a primary care provider, then please call Witham and we will assist you in getting a primary care provider, because it is our belief that everyone needs a primary care provider. Even if you're young and healthy, you still need someone that can help you in times like this and who can see you when you do have health issues that come up. So please call us if you don't have a primary care provider, and we will assist you in locating one just to meet your needs.
So what if we have an employer that's concerned about spread of a virus within their location? What can people do in order to help mitigate the risk of transmission?
Well, I think across the board, individuals can help to mitigate the risk of transmission by, number one, wearing a mask, social distancing, and washing your hands, or using hand sanitizer on a frequent basis. Those are the three things that all individuals can do, no matter what your situation is. If masks are recommended for individuals who, for anyone except those that are 2 and under, or who have altered mental status that cannot, control their airway, cannot take a mask off if they need to. So that there are those few exceptions, but otherwise, I think everyone should be wearing a mask when we're out in public and social distancing. Now, obviously, in your home, you're cohorting, limit your contacts in your home. So, try to avoid large gatherings, large parties that you might have without wearing a mask. So, those are the things everybody can do. As far as employers, if they're concerned, again, the CDC site has a lot of information about what workplaces can do to decrease the risk of transmission. And I know that several facilities and workplaces in our county have adjusted things like their work schedules, where when shifts come in and go out, to try to limit the amount of people that are in contact with one another. They have provided sanitary hand stations. Some of them have required masks in their facilities. If they have any questions, any concerns that they need answered, Dr. Surveys, as the health officer right now, is the key person for them to contact to get further guidance and further assistance.
Then if I can add one more thing, the Indiana State Department of Health offers strike teams to businesses and different facilities that would be interested. And so those strike teams, basically they're just a group of experts that can go to different businesses, and they can really work with those businesses to try to figure out the best game plan that they can have in order to mitigate their risk. From what I've been told, they are extremely thorough. They tend to reach out to the groups very, very quickly. And it just seems like they go through the facilities, they try to identify any gaps, and essentially they don't leave any stone unturned. And I think that's a very appropriate attitude to have when it comes to slowing the spread of COVID, is don't let any stone lay unturned.
People believe that they've been exposed but aren't showing any symptoms. What can people do in order to keep those around them safe until they figure out if they can get a test? Do they stay home from work? What are your recommendations?
Well, if someone has been in contact with a known COVID positive individual, then the current recommendation is to self-quarantine, voluntary self-quarantine for 14 days, and to monitor your your temperature and for yourself for signs and symptoms of COVID.
The asymptomatic person has been probably the driver of this whole pandemic. I mean, there are a lot of folks who either have no symptoms or might have one symptom, such as a headache or body ache or fever, for one day, and then it's gone. And we all have those days when we have headaches, and we all think we've had this 24-hour bug. But this has been, I think, the hardest thing with this pandemic is trying to identify folks who are asymptomatic. It's just almost impossible to do.
So as kids go back to school, we're going to see more people in contact with one another, going back to their families at home. What should people be looking for? What should people be paying attention to whenever kids are going back to school?
This has been since probably April or May. The health department, has been working with the schools in our county, the Lebanon, Witham, Zionsville, Traders Point, and we're trying to develop back to school guidelines. And the thing was interesting that then our positivity rate was about 2.3%, and we were patting ourselves on the back and saying how good a job we were doing. And then July 4th hit all of us, and our rate went up to 7 and 8% the week after July the 4th, and has stayed there since then. And so that's when, we thought back in April and May that we were just going to go back to school, period, and that was it. But then as the numbers kept staying up and staying up and staying up, we had a consultations with the superintendents again, and that's what happened with this hybrid model that all the schools are using in the county right now. The other thing about this is we have known from the very beginning that we are going to have positives in school. There's just no way to avoid it. It's going to happen. It'll have to be dealt with on a case-by-case basis. When we started with this, I remember the superintendents asked us to maybe give them 10 or 15 scenarios that we could do to help them decide how to deal with issues. Well, the trouble is there's no scenario that's the same.
Mm-hmm.
It's just a different, and you almost have to sit down, and we have to, at the health department, have sit down and kind of bounce it off each other for a few minutes before we make, give the right decision or give the right call. But I know Claire's takes these phone calls all the time, so.
Mm-hmm.
And I do, especially on Facebook, we get a lot of questions, be like, okay, well, what if this situation occurred and X, Y, and Z variable factors in? And I hate to say it, but oftentimes, they just want to know, okay, what would you do in this situation? And most of the time my answer is, well, it depends, because there are all sorts of different tiny little variables that could factor in that would impact that decision. So we don't necessarily have a blanket statement for any one or any combination of scenarios that could happen. Is it just, again, it's a case-by-case basis.
So someone does bring COVID home from school. What does a family do in order to keep that person isolated and keep the rest of the family safe?
Well, ideally, we'd like for the person who came home positive to try to isolate themselves the best they can. And by that we mean being in one bedroom by themselves, try to use a different bathroom than everybody else is using, eat meals in that room, etc. It's pretty hard to do. My concern has been, though, we've got folks who live in a 1,000 square foot house and 3 bedrooms, and how do you isolate those folks? There may be 4 or 5 kids in the house, and mom and dad are there, and we see folks who've been able to isolate themselves in that manner, but it's hard to do.
I think the other thing that's important to realize is that oftentimes these people, once they begin to show signs and symptoms, and that's oftentimes the first thing is when they begin to develop symptoms, they're oftentimes contagious 48 hours before those symptoms oftentimes start. So they've already been exposed at that point, period. So at that point, everyone in the household really needs to isolate at that point for at least 14 days, as Dr. Jones has said.
And what other cleaning procedures can they undertake in order to make sure that the house is as clean and virus-free as possible?
Well, fortunately, the virus is not too terribly sturdy. There's some viruses out there like norovirus, correct me if I'm wrong, that can survive on surfaces for very long periods of time and can be very difficult to kill. If folks want to go to the EPA website, the Environmental Protection Agency, they have a list. It's a pretty good sized list of all these disinfectants and cleaners that have been shown to be effective at killing coronaviruses. So that's a really great reference point. And a lot of them are products that I would say we would normally see on the shelves, but it's kind of hard to find cleaning products nowadays. But a lot of the times it's like Clorox, Lysol, things like that. And so if you can get your hands on those, that's excellent. But oftentimes I know disinfecting wipes are especially difficult to come across. But then I would suggest that people take a look at those spray cleaners. I personally think those give you a little bit more bang for your buck than bleach wipes. And they do tend to kind of smell kind of strong sometimes, but with those cleaners, you don't need to leave it on the surface as long in order for it to disinfect. And those tend to be a little bit easier to find. So folks really need to be conscientious of those high-touch surfaces. So doorknobs, keyboards, phones, light switches, the handle to your microwave, the handle to your refrigerator. And so they really need to be conscientious of all the different surfaces that they would touch throughout the day. And then also the folks who may be symptomatic or maybe they're not symptomatic, it would be very important for them to be mindful of the surfaces that they touch, and also how often they wash their hands. And we're oftentimes not aware of how often we scratch our nose or rub our eyes or touch our mouths or things like that throughout the day. And so being mindful of that would be very important, because if somebody touches their nose, eye, mouth, whatever, that's a way for the virus to get introduced into the body. And it is also possible that by coming in contact with those bodily fluids, so like mucus or things like that, and they touch a surface, then all of a sudden that surface becomes another mode of transmission. So other people touch that surface, then they rub their eye, they rub their nose, and then it's just a vicious circle of infection.
So let's talk about mask wearing. So, if people are using and wearing masks and are touching the outside of the mask, mine's a reusable mask. I should be washing this on a daily basis. You are wearing disposable masks. Those should be disposed of and using a clean one. Let's talk a little bit about making sure that people, whenever they're properly wearing masks, because kids are supposed to be wearing masks in school, people are often supposed to be wearing masks whenever they're at work now. Let's talk about proper mask hygiene.
I think one of the most important things is that if they're going to wear the mask, it's important that they wear them appropriately. And that means that when you do wear a mask, it has to cover both the nose and the mouth at all times. And it's important that people are not doing a lot of manipulation of that mask. It's important that people find a mask that fits and it fits appropriately. Sometimes you may have to make some adjusting to the earpieces, but the more that you manipulate it, the more you touch it, it is considered contaminated. So people should not be touching it, but they should be ensuring that the nose and mouth is covered.
And some people find that different materials work better for them. Personally, I find surgical masks a little bit more comfortable than cloth masks. But if you talk to my husband, he prefers the cloth masks over the fabric masks. Some people prefer the pleated masks, like the style that this is. Some people prefer what they call an Olsen style mask. So everybody's got different preferences. So if you find one type of mask that maybe isn't that comfortable for you, then maybe look into a different one. And periodically we do get donations of cloth masks to the health department. So if somebody is having a difficult time finding masks, then they can reach out to us. I just had a lady reach out a couple weeks ago. I think she was an elderly lady. She might have been homebound. I'm not entirely sure, but she had a hard time finding masks, and so we were able to whip up a couple and send it out to her.
And hand hygiene. Everyone talks about 20 seconds, right? Is that still the standard?
Yes.
And it needs to be with warm to hot water, not just whenever you turn the water on, you kind of get tepid water, cooler water. So is there anything else that people should be doing whenever they're washing their hands, making sure that they get around their fingernails and the creases?
I think that's important. And I will just say, you say, well, how much is 20 seconds? You can count that out, but typically with children, in the public health arena, we would say sing the Twinkle Twinkle Little Star song or sing the ABC song, and that's about 20 seconds. At the normal speed, not sing it really fast, but how you normally sing it as kids. And I think most of us probably remember those songs. I don't know if they still sing those now, but probably. But really, the friction is important. The soap, warm soapy water. You're right. Paying attention to the creases and the around the fingernails. It's very important. Up to the wrist. Ideally, a disposable towel or to dry it. A hand, a air dryer if you're in a facility or business. Using that towel to turn the faucet off. Because you've touched that faucet, and then if you go to turn it off with your clean hands, you've just contaminated your hands.
I think it's also important to remember when to wash your hands too. If someone is coughing or sneezing right now, if we have a mask on, that may be protecting it. People should remember with cough hygiene is making sure that if people do use their hands, to use a Kleenex, or they need to make sure that they're washing their hands after that, anytime after before they eat, or after using the restroom. Anytime that your hands are going to be soiled, we should be washing our hands, and people just need to do it frequently.
What else would you like people to know?
I would say, I know there have been a lot of controversy surrounding masks. Yes, it is true. The World Health Organization and the CDC, months ago, they did not recommend the use of masks at the time, but their recommendation since has changed. And again, we're constantly learning new information, and it's okay that things that we thought in the past turn out to not be correct. I know that that's one reason why bloodletting is not considered a good medical practice nowadays. It used to be way back when, but then we learned a little bit more, and now we're thinking, maybe bloodletting isn't necessarily the best thing to do if you have like a toothache or something like that. So face masks are still incredibly important. No, they're not foolproof. They're not 100%. Just because they may not be 100% effective doesn't mean we should completely disregard it. Research has shown that the more people that wear masks and wear masks properly, they greatly decrease the chances that they might pass the virus off from one person to another. And it's not our only way to fight back against this virus. It's just one puzzle piece in the entire grand scheme of things. So just as everybody else was mentioning, hand washing, social distancing, staying home when you're sick, and also washing your hands frequently. Those are all of our biggest tools that we can use in order to fight back against the coronavirus. And only doing one or two things isn't necessarily the best thing to do. We need to use all of the tools available to us in order to fight that virus.
I guess what I want everyone to know is that Witham Health Services is using the most current and up-to-date guidelines that are coming out. As it already has been said, those guidelines continue to change, and this is a team approach. We're working as an entire team. Our medical staff, our nursing staff, our entire organization is working together to stay abreast of the changes that are occurring and are occurring rapidly. Not only that is, we are also partnering with the Boone County Health Department and working with our school corporations, working with our business leaders and community to ensure that our community is being served and their healthcare needs are being met. So Witham Health Services is here to be an integral part of that team.
I think socially, people have gotten lax about social distancing, about the masks, etc. One of our doctors yesterday, in fact, was saying that he took his child to school, and all the little kids were coming out of the cars. They all had masks on, and they had their backpack, and they were going in the buildings. But then he said, looking around, there were parents standing around talking to each other without a mask on. So it's this is what's happened since July the 4th. I think when the governor, released some of the restrictions that we were under, everybody thought, oh, okay, well, we're doing a lot better, and then kaboom, it hit us again. So I've also heard the argument, well, we're not seeing the deaths that we used to see, and we're not seeing hospitalizations that we used to see. And that's true, but the bottom line is because we were doing the right things, and we are doing the right things. I've made some decisions in the last few months that I didn't want to make, and people have, felt bad about me making those decisions. It's not that I'm making anything up. I'm just trying to protect everybody in Boone County that I can.
The last thing I'll say is that we just need to remind ourselves that even though this is a new virus and we are learning about it as we go and having to deal with it, pandemics have come and gone, and communities have survived, and they survive by being united and helping each other. And I think that's what we in Boone County need to do, and in the state of Indiana and in the world, is that we all need to work together to fight this illness, and we will be successful. It just takes some time.
Thank you all for joining us today. We certainly appreciate your time. We appreciate your efforts. We appreciate the fact that people are watching this so that they can learn more and be more educated about what they can do in order to fight the coronavirus. Thank you for joining us. We appreciate you taking this time and finding out what you can do to be more prepared.